I'm Nicole Porter with the Sentencing Project, where I'm the advocacy director and work with many advocates from across the country working to challenge mass incarceration who've continued to do that work over the last couple of weeks during the midst of this pandemic, while folks have been working to get people released to protect them against COVID-19. Many of you who are joining us this afternoon are doing this work in your states and in your local jurisdictions. You may be aware of releases in California and New York and other states around the country like Michigan and Florida. There have been some modest reductions in state prison populations and greater reductions in local jail populations. We're going to hear today from 4 seasoned advocates who are working in the field in Ohio, Louisiana, Wisconsin, and Missouri. And that work is going to focus on decarceration and practical strategies that advocates can be working on to support releases and also reentry services for people released due to COVID-19. There have been limited releases from prison, but as I shared with advocates earlier this week, no state is doing what they should, although some states are doing more than others. But what's important to know is that US releases are minor and pale in comparison to what's happening in other parts of the world, where in some countries, even autocratic ones, like Turkey and the Philippines, there are tens of thousands of incarcerated residents who are released with the goal of managing down correctional populations to prevent the spread of COVID-19. So now, in the midst of this pandemic, is the time for the impossible. And some of the impossible has been done at the local level, stopping admissions to jails for certain categories of residents. The impossible could be extended to the state level, escalating and elevating and expediting releases for even long-term sentenced prisoners, people who have served decades in prison, who may be medically vulnerable, may have reached age 50 or older, or may tick several boxes in terms of why they no longer should be incarcerated, and their release would embolden their health and keep them safe from this vital issue. So we're going to hear first from Checo Yancy out of Louisiana. Checo is a leader with Voices of the Experienced, voters organized to educate. He supports leadership of formerly incarcerated activists like himself, and is a formerly life sentenced prisoner who was incarcerated in Angola and has continued to lead efforts down in Louisiana. Following Checo, we're going to hear from Christine Woody, who's a senior advocate with Empower Missouri. Her work has supported state advocacy reform and criminal justice reform with Missouri's Smart Sentencing Coalition. That work has mobilized support for releases from prison and jail during the COVID-19 pandemic. And her work has connected to advocacy on reentry support amongst direct service providers for housing and treatment. And we're going to learn about some of the practical efforts around that. Following Christine, we're going to hear from David Singleton, who's Executive Director with the Ohio Justice Policy Center. Last year, David launched the Beyond Guilt initiative to transform that state's punitive legal system by focusing on the humanity of the overpunished. So this afternoon, we're going to hear about how that initiative has continued its work in the midst of the pandemic. And then lastly, we're going to hear from Sarah Ferber, who's Associate Director with Wisconsin's Ex-Incarcerated People Organizing. Sarah is a formerly incarcerated organizer herself who supports leadership amongst local leaders, including centering the voices of and experiences of justice-involved women. So first, we'll hear from Checo. Checo, can I hand it over to you?
Thank you very much. First of all, thank you for having me. You know, when you're thinking about all of this and what we're trying to do right now and where we came from, first of all, my name is Checo Yancy. I'm the C4 Director for both Voices of the Experience. It really started out Voice of the Ex-Offenders, but we changed that name. Now we have Voices, Voters Organize to Educate. So we took that acronym to put it in 2 or 3 different things. But I spent 20 years in prison. I had a life sentence. I was sentenced in 1983 and spent 7,309 days in Angola. When we're in Angola, you know, we saw back in those days in '87 that they were talking about that it was going to be riots in prison because nobody was getting out of prison and all of that. And Norris and all of us started talking and saying, hold up, nobody gave us the memo that we were supposed to be rioting. We were talking about, let's organize, let's do something different, let's get our families involved because voting is the most important thing that we understood that could change things. So we actually did that. We actually wrote our first bill in prison. And it was about getting people out of prison. That's still our focus today. Although we are trying to get people registered to vote, we're doing all sort of other things. But the main thing is our focus is to get men and women out of prison. And, you know, it's good to hear about Sarah, but, you know, people forget about females. It's always about the males that's getting out of prison. But we have our organizers that we have offices in New Orleans, Baton Rouge, Lafayette, and Shreveport, and all are run by former incarcerated people. And we have women in key position, organizing and doing things. We have Ivy that's been in prison 26 years. We have Consuela in Lafayette. She was in prison over 20 years. And, you know, we have a lady was in federal prison in Shreveport. She was in prison. So all this is about prisoners and getting them out. And during this pandemic, I was just looking at my notes here. You know, we're trying to organize and mitigate with the people on the inside and the what can I say, the relationship we have with the Department of Correction and helping people to get out, because people are, you know, we know now, and I'll say this because I was telling the reporter the other day, besides nursing homes and prisons, they are stacking up bodies and nobody knows the real thing of what's going on. So it's very important to get people out of prison. We work with DOC, but we're finding out that DOC really, you got the guards that got masks on and nobody else got masks on. So we're advocating. We had the NFL that gave us a big donation, and we took 8,000 masks and donated to DOC for the men and women on the inside. You know, but we're still having problems because men that's been in prison that are on dialysis, cancer, old, and all of this, they are put in that hospital and they're put in places that nobody knows what's going on. So we're trying to get them out of prison. The pardon board shut down, the parole board system shut down. They just started back up. So, you know, they're still talking about violent offenders and nonviolent. Well, to me, right now, the pandemic, we need to be helping everyone. And if a person has a place to go and a place to stay, we need to be helping those people. So we're actually, you know, last week, the women did an organizing to all the prisons around the state. They're getting ready to do it again this weekend. So we're very active in doing these kind of things because, you know, each person in prison is very important to me. And, you know, one thing that Norris reminds us that, hey, that you can never, if you've been in prison with somebody for 7,000 days, how can you leave there and forget that person? How can you forget that person that was right there with you? And I get kind of emotional with this because it's very dear to my heart that someone helped me. So I want to make sure that I reach back and help somebody else, you know? So we have so many efforts going on. If I tried to name all of them, we have a JPay account that we set up with our organization that these guys can call and their families can call and give us the information that's going on inside because we can't get in. So, you know, we're getting all kinds of stories that the guards, you know, somebody posted on Facebook, the guards posted with PPE equipment on, but now the guys in prison don't have them. They made masks for them, so we give them masks. So there's no, when I was in prison, it was 60 people in a dormitory. Now they are double bunking and it's 83 people in prison. So we're getting letters and stuff from people saying that there's no social distancing. You know, sometimes the guards don't even want to come in the dormitory. So what are we to do except keep advocating? We've been to the governor, we've been to the secretary of Department of Correction, and we will continue to do that. Then we have the local jails that's even worse than the prison, because you got pretrial detainees that's in the local jail that haven't even been convicted yet. So we've been trying to get these people out. So there's this fight does not stop. It goes on, and we have to understand that until my last breath, I'm going to fight for people on the inside, because someone fought for me, and we can never forget where we came from. And you know, all the details, I could probably give all kinds of details, but my main message is we have to continue to fight, because when I see Sarah there and hear that she's been in prison, we'll just have to do what we got to do.
Checo, thank you so much for your words and your guidance in terms of leaving no one behind and continuing to fight for those inside. Next, we're going to hear from Christine out of Missouri. And before we go to Christine, I want to encourage people to offer comments and questions. We've already been getting some questions and comments in, and we are going to leave time this afternoon for some discussion with the panelists and the audience members. So feel free to weigh in as our panelists are presenting with any questions you may have. So, but with that, I'll switch it over to Christine. Christine?
Thank you, Nicole. I appreciate you asking me to join you today. As Nicole said, I'm with an organization called Empower Missouri. We're based in Jefferson City, the capital of Missouri. We're over 100 years old. We are a statewide advocacy organization. We advocate on a wide range of social welfare issues, criminal justice being one of them. We also work on food security, and housing and homelessness are our three main pillars. So we've had a criminal justice task force in some form or another for decades and decades and decades. And this task force is statewide and consists of folks, individuals, advocates, a lot of direct service organizations, folks who have family members who are incarcerated now, a lot of individuals who have lived experience. And we're all do most of our work on state level policy and trying to change some of the state level laws that are on the books in the state of Missouri. So as I said, we've had this task force for a long time. Our coalition meets once a week, every Friday at 11 during legislative session in Missouri, which is January through May. So even in the midst of this pandemic, we've been meeting every Friday at 11 a.m. To touch base and talk about actions. And we do that throughout the year. It's not as regular when it's not legislative session, but throughout the year, we do meet via conference call, in person, throughout the year. So we've been doing that for many years. So a lot of the advocacy work we do hasn't really changed since the pandemic. A lot of it now has been enhanced and has to move a little bit more quickly because of this. But a lot of what we do is similar to what we've done in the past. So since the pandemic has kind of hit Missouri, we've done a lot of different things. So we drafted a couple different sign-on letters with the assistance of Nicole and the Sentencing Project, and a whole list of asks that we'd ask for the governor, the Department of Corrections, and the Department of Youth Services to implement in light of the pandemic. So we crafted these two letters and created them in sort of a sign-on action alert format, where we were able to gather signatures from organizations and individuals all across the state. And we had two separate Zoom call meetings with governor staff to talk about those asks and present them with our letters, share with him our thoughts of how this situation could be best handled within the Department of Corrections. We did that in light of the Department of Corrections and all the adult institutions, as well as with the Department of Youth Services and the juvenile justice centers. Very similar asks, but just two different departments who run those in the state. Additionally, in our conversations with Nicole and the Sentencing Project, we learned about some funding that was put in place during one of the COVID-19 federal legislation bills that passed. that was increasing the amount of money that was going into the Burn JAG grant funding, which is a pot of money that is accessible all year round to help municipalities and states with criminal justice expenses. So there was additional money that was put into that grant in one of the legislations that just passed. And there was some hope that maybe that money could be used not just for emergency medical equipment for personnel, but maybe for ex-offender organizations, those returning community reentry organizations, nonprofits that are working with housing and food security and other things like that. So we inquired to the governor's office to see if the state of Missouri had applied for this funding. And within, I don't think it was probably our advocacy with them, but after the fact, we had learned the Department of Public Safety did in fact submit an application and received $11 million from that funding. So we inquired in the Department of Public Safety to access that application and to see what the budget said. In addition to that, we are only a advocacy organization. We don't do any direct service or any community reentry work, but we work with a lot of organizations that do. So we reached out to quite a few of our nonprofit organization partners and told them to reach out to their contacts with the state, because a lot of those organizations are already receiving state funding, have state contracts for a lot of the work that they're doing. So we asked them to touch base with their state contacts and inquire about this potential funding opportunity to help with some of their direct service needs. Those are the two biggest things that we've done in light of the pandemic. Just kind of trying to encourage the governor to make some changes with how they handle releases and incarcerations, as well as inquiring into the budget process with that specific grant funding. So.
Great. Thank you so much, Christine, and thank you for weighing in from Missouri this afternoon.
Sure.
I think one of the key points out of Missouri, particularly with Empower Missouri and the Smart Sentencing Coalition, is the regular communication that happens between Empower Missouri and coalition partners, and the space created weekly that shares out information, particularly as developments have changed given the pandemic, where Empower Missouri, along with its coalition partners, can come together, but continue to build momentum and move forward on next steps to target the governor around releases and other strategies to improve the condition for people inside. So thank you for sharing that this afternoon. So now we'll move to Ohio. I think one of the benefits of working from home and organizing from home is that distance is flattened between advocates and between groups who are challenging mass incarceration around this country. So we'll move quickly from Missouri to Ohio, where we'll hear from David Singleton with the Ohio Justice Policy Center. Take it away, David.
Good afternoon. Well, distance certainly is flattened, and I am so honored and privileged to be part of this panel. Thanks for inviting me. Congrats to all of my co-panelists and everybody out there who's doing work on this issue. Thank you for what you're doing. And so the Ohio Justice and Policy Center is a public interest, nonpartisan, nonprofit law firm that represents people involved in the criminal legal system. We represent folks who are incarcerated in state prison if they've got civil rights issues, say they're denied medical care or they're denied religious rights or they're abused. Those are the kinds of cases that we typically handle in prison. We also represent people who are returning from prison to the community. We help them with the various legal issues that they face. And we do a lot of policy work around decarceration, around trying to find ways to make the criminal legal system truly become more justice focused and oriented. A year ago, Nicole mentioned this in the introduction, a year ago, OJPC started something called Beyond Guilt. And Beyond Guilt is designed to free as many people as possible who admit guilt to what they are in prison for, have served a long time, often they've been in for decades, and can demonstrate rehabilitation. frankly, I got tired and our staff got tired of leaving people behind. Too often the focus is on trying to free people who are wrongfully incarcerated, who are factually innocent, or who committed low-level nonviolent offenses. And we are diminished as a society when we leave people behind who made more serious mistakes, but are redeemed. And so in this year that we've been doing Beyond Guilt, we've freed over 15 people who were locked up for serious crimes, including 3 people who were serving life sentences for murder, had not even gone up to the parole board yet. And we were able to work creatively with prosecutors to come up with mechanisms to get back in court and have the opportunity to plead to something like manslaughter that got them out. And every single person we've gotten out has been soaring. We support them, they do well. And we're hoping that we can help them lift up their stories so that they can pave the way for more substantial reform in Ohio. So what does that all have to do with COVID? Well, since the COVID crisis hit, basically OJPC pretty much has been doing nothing but Beyond Guilt work through to address the COVID issues. And we've done a number of things. The first thing we did was to put out some recommendations for how jails around the state could reduce their prison population, or their jail populations rather. And that was more successful than efforts to reduce the prison population. For instance, in Hamilton County, where I am located, where OJPC is headquartered, our jail population went from 1,200 people down to 800 people with a snap of a finger. Obviously, not all those people needed to be locked up before COVID, and hopefully we'll be able to preserve that reduced level once the COVID crisis ends. In Cuyahoga County, where Cleveland is, there was similar success, and some of the other major metropolitan areas of the state have had success in reducing their jail populations. With regard to prison populations, you know, listen, the Governor DeWine gets high remarks for how he has managed COVID generally in our state. But I wouldn't give high remarks in terms of what's happening in the prisons. We have called on him, along with others, to use his power to substantially reduce the prison population. We are a system designed for 38,500 people, and we've got 49,000 folks crammed in there. And the governor has only tinkered with reductions and has made recommendations to local judges that about 200 people be released, and that's way inadequate. So we've stepped up, along with public defenders across the state, to do mass judicial release campaign. And we've, you know, OJPC itself has represented dozens of folks to try and get judges to release people where they are eligible for the statutory form of relief. We have come up with some creative strategies in some cases to try and get people basically a furlough. And the way we're doing that is in cases where people pled guilty and they have really serious medical issues, we are asking the judge to let the person withdraw their plea, immediately plead guilty again to the same charge, but delay the sentencing. So basically it would be pausing the sentence while the COVID crisis happens so that they could resume their sentence and complete it once the crisis ends. Now, obviously, we'd rather them just come home and be home for good. But first priority of many of the folks who are writing to us is just to live, because they didn't get a death sentence and we're worried that they're going to have a death sentence. I've got one man right now that we're fighting for who went into prison right after a kidney transplant. He's on immunosuppressant drugs. So if he gets COVID, he's likely going to die, and he's got diabetes and hypertension, a triple whammy of comorbid conditions that could make him a dead man if he gets the disease. So we're trying those strategies, and we've also been involved in some major litigation. The only federal prison in Ohio is located at Elkton, and the ACLU launched a case. We're partnering with them on it to get medically infirm, medically vulnerable federal prisoners there transferred out or sent to home confinement. And we won. We won in front of the federal court. The Bureau of Prisons is appealing to the Sixth Circuit, but I think we're going to win. And the order requires hundreds of vulnerable prisoners to be transferred or sent home. So hopefully that will be sustained. And then last but not least, we've been some policies, more avenues for judges to release people when there are health crises. And the process generally takes too long if you go the normal route. Some judges are ignoring the process and doing the right thing, but we're hoping to get the legislature to expand the opportunities judges have in situations like this to send people home where they can be safe. So I'll stop there. That's basically what we're doing in a nutshell to try and get on top of the COVID crisis in Ohio.
Thank you so much, David. Next, we're going to go to Sarah out in Wisconsin. Again, we're able to zip around the country to hear these great stories of activism and reform and trying to help people during the midst of this pandemic. I'll say this, while David was talking, we have a comment from Mildred, also in Ohio, who says that Governor DeWine is not doing enough to release people during COVID-19. That's certainly true, Mildred. No governor is doing enough, and that's why we're here hearing from these activists and advocates, sharing the tools and strategies they're using. And we know that in the midst of this crisis, all the tools in our toolboxes are important. So we just heard about litigation strategies, and earlier we heard about advocacy efforts with the seasoned statewide coalition. And we heard about activism from a formerly incarcerated leader in Louisiana who's working to support the leadership of folks on the inside. And now we'll hear about community organizing and other direct action tactics to build momentum in Wisconsin to target another governor who's also not doing enough to release people during COVID-19. So with that, I'll turn it over to you, Sarah.
Thank you. And I just want to say thanks to everyone for inviting me and Expo to be on today. I want to echo what David said about people being redeemable, right? It's so frustrating to hear when people are talking about only low-level nonviolent offenders. Bottom line is that people were not sentenced to die in prison from COVID, and we need to be drastic and really make sure that we're getting folks out of there. So Expo is part of a statewide organization called Wisdom, and for 20 plus years, Wisdom's been working on all sorts of social justice reform things, with justice reform being right at the top of that list. And in those years, we've worked on getting people out on compassionate release. Our parole laws changed in the early 2000s, and so what we call old law parole, we've been working really hard to get folks, the 2,500 people in our prison system that are stuck on old law rules when we're in a new sentencing structure now. And then anyone, we've also been working to change the tactic of crimeless revocation. So that's when people are incarcerated, they're sent back to prison, maybe even sent to prison for the first time based on a rule violation of their probation or parole. And so we've, again, those among other things we've been working on within the Wisdom Network for many, many years. And so on March 14th, when the prison systems went on lockdown, we knew that we had some solutions because we've been asking for these same things for many, many years. And that was those three things I had mentioned previously. So within 4 days, we had wrote a letter to Governor Evers and Secretary Carr, the DOC secretary, asking them to enact some of the things that we had already been talking about, the old law parole folks, the people who are there who would be eligible for compassionate release, and then to end crimeless revocation to really drastically reduce our prison population. We did see some movement in the jails. So really early on, we heard about the probation and paroles not arresting people on things like crimeless revocation. We heard about the jails actually releasing folks that were on Huber. So that's like a work release type program here in the state of Wisconsin. And so seemingly a lot was happening, but we weren't hearing anything verbally. We weren't seeing on the news. Nobody was actually addressing to the greater public what was going on with the folks that were under DOC and local sheriff care. And so also right shortly after that, we did a petition. So we sent out a petition call our goal was to receive 1,000 petition signatures within 48 hours, and we surpassed that goal by several hundred. We received over 1,300 petition signatures, and we delivered that to the governor's office asking for the things that I just mentioned previously. Now, we didn't see a big release, right? We didn't see the governor check the box, even though he may agree or may have verbally said he agreed with us. It was kind of a lot of finger pointing of, you know, we can't do it, it has to be the DOC, or the DOC can't do it, it has to be another area. And so we've just constantly kept that pressure on. If we get pointed in a different direction, then we follow that trail in a different direction and start to talk to that person. So again, we delivered that petition. Our petition asked that we release those folks that I mentioned, and then we did get a memo from the DOC stating that they were going to release some people, again, nonviolent, people with misdemeanor offenses. And so, you know, that part was frustrating, but at least we were seeing some movement. Now, since then, what we know is that we're only about 250 people ahead of what we normally are as far as releases this year, right? And so we have not done enough to decarcerate our prisons. You know, not unlike, I believe, David mentioned over there in Ohio, our prison systems are far surpassed what they are meant to hold. And we need to see much more drastic actions happening. So locally, again, you know, we've seen some stuff. We actually have signed on and worked closely with the ACLU when they are putting out calls to the different sheriff's department, making sure that the sheriff's departments and the jailers are using PPE, things like that. But we have seen a slow in release, you know, we have seen a slowdown in releases. And so we continue to utilize online platforms, doing things like this, webinars each week to alert our base and the greater public as to what's actually happening, since we're not hearing anything from the governor himself or from the localities that are holding people. And we're just going to continue to put the pressure on over the next, however long it takes, you know, because again, these people were not sentenced to life. So. And even if they were, they shouldn't be dying of COVID in the prison systems.
Absolutely. Thank you, Sarah. And now's an opportunity for all of our panelists to join so that we can have dialogue with each other, and then we'll move to answering questions from the audience. We'll encourage folks to post any questions in the chat. There's already been some very engaging and provocative questions and comments offered already, and looking forward to get to those in a minute. One question to start us off with this afternoon is, we're several weeks into this pandemic. You all have talked about strategies and tactics you've employed to help get people released, to prevent their contracting COVID-19 and hopefully contain any outbreaks inside of correctional facilities. I'm just wondering, have there been any new tactics or observations you've learned over the last few weeks given the pandemic that you weren't aware of before COVID-19 started?
I'll take a stab at that. I don't know that I would say that there are new tactics that we've become aware of. What has really been driven home to us is how we have to work together with a lot of different folks and brainstorm as creatively as possible to put as much pressure as we can on the system to change. This has been a really, I mean, it's the silver lining is it's really brought a lot of folks together in Ohio who need to be working more closely together to get decarceration to happen. And so this moment, I'm hoping won't be, to me, as I sit here right now, is the importance of the community that we're a part of, and it's a diverse community of folks who are directly impacted, folks who don't know much about the criminal legal system, but care about not seeing people die from COVID when they can't socially distance. So I think it's been an opportunity to come together, and I think that and hope that we'll be able to continue that going forward.
Great. Anyone else?
I echo what David is saying. You know, this has really brought people together with families that had no other avenue. They didn't know there were people out here like organizer people doing this. You know, they always heard one side of it, but when you have your loved one in there that's been in prison maybe 40 years and already in the infirmary in Angola, you know, can't help themselves. And then you find out you have advocates like these people across the state, across the country, doing this kind of work. Education is powerful. You know, ignorance is just a lack of knowledge. When people don't know and don't know what to do, it's not that you're dumb, you just don't know what to do. When you find out you have people out here that's fighting for people that's been inside prison and now out here fighting to help people, and like David and Sarah and Christine, Nicole, you know, I was with you in Michigan not too long ago, but you know, the thing we're doing is people don't understand when they hear that, then people realize, you know what, we have a voice. And you know, we're really mad here in Louisiana because we actually helped elect this governor that's in office now, and we expected big things from him, and he's sending us down rabbit holes. DOC said they can't do anything. The governor said he can't do anything. So, you know, we have to really put pressure on everyone, and we've had news media to do it. And again, I can't express it enough. People have forgotten about women that's in prison. And we have organizers, there's ladies that's really doing tremendous jobs, that's out there advocating and doing things. And, you know, that's the thing that we have to do. We have great news media. I just got off the phone with some press a while ago. So if we continue to do this fight, we have to, you know, just fight, fight, fight. We just cannot give up, because we're going to find out after COVID is, you know, people are talking about socializing and getting back out to work and everything. We're going to find out what I believe in person in my heart, that the nursing homes and prison, you know, like we see on the news, they've been stacking bodies in nursing homes and nobody knew anything. I'm believing that in prison, they're going to have bodies stacked up that nobody know anything about. Because sometimes we're hearing that guards don't even want to go inside the dormitory and just say, hey, it's a free fall, you know, so we just have to fight. Thank you.
Yeah, thank you. Christine or Sarah, did you all have anything to add before we move to the audience questions?
Yeah, I just wanted to add that really, so I would echo what David said, that it's not that we found out new tactics, but we really have taken advantage of the fact that we can reach some people with trainings and to get people to learn about what organizing is and how they can use their voice in a different way than we have in the past. You know, before we had to physically get someone to a place, and now if they have digital, if they have a camera like this, and even if they don't, if they can call in, they can be part of a training. And so really just taking advantage of that opportunity and making sure that we continue to build those voices up of people who really understand firsthand what it's like to go through this stuff.
Thank you. Christine, before we move to the audience, did you have anything to add? Okay. Well, there are some questions, so I'll just start them. And Morgan, I want to invite you to join if you have any guidance for going through the questions this afternoon. But I'm coming across one question from my colleague Tony in Georgia, who has a question for Checo at Vote, asking if the stories he's been able to capture from families or specific individuals inside, if those are included in any of the letters going to the governor and other public officials, and are those efforts getting covered by the media? So Checo, the question is including the personal narratives of incarcerated folks in these letters going up to the governor, and what the media might be doing to cover that, and any reactions.
Yeah, we are getting some media coverage, because, you know, the media like stories and stuff like this. And, you know, I was just reading something and putting it up here, reading suspending speedy trial rules amid virus outbreak could leave inmates lost in jail, advocate says. Now, people don't see that until they think about, wow, you mean you got people in prison and only people talking about is the advocates, you know? So that's what we do. We advocate for other folks. And once this gets out, then people understand that pretrial detainees, people in Angola that's been there 40 years already with diabetes, doing dialysis, all of this, and these people could be out safely. But if the advocates don't say anything, who else is going to speak? So vote, that's what we do. That's our mission. You know, I tell everybody, team means together, everyone achieves the mission. And everybody on this call here is team. Together, everyone achieves the mission, because I don't have the best idea, but collectively we have a good idea. And if we all do the same thing, as David said, as Sarah said, Christine, and all the people around the country here, we have to put pressure on the governor, the people that we elect in the office. And if we don't do it, who else is going to do it?
Yeah. So we have a second question for Christine. Christine, can you talk a little bit more about the funding strategy, organizing around funding for reentry service providers in Missouri? There was a question about where did the 11 million come from? So they may have not heard that or understood exactly where that 11 million comes from. Can you speak a little bit to that?
Sure. So Nicole, you probably have more details about the backstory of this Burn JAG grant than even I do, because you're the one that made me aware of it. But within one of the pandemic federal legislation pieces that passed through Congress, there was additional money that went into a grant stream called Burn JAG, which is BYRNE JAG, JAG. And that money can be accessed by municipalities or states to fund criminal justice sort of expenditures. And part of that can be reentry costs. So like helping folks find housing or other find employment or other sort of reentry services. Additional money was put into that fund through one of the pieces of legislation that passed Congress in light of the pandemic. And we were inquiring into if the state of Missouri could apply for some funding to then be used for nonprofits to work with community reentry. Well, if they are going to release folks, there could be some extra resources and funding to help people come back into society and reenter. And the Missouri Department of Public Safety applied for funding. It's $11 million. We are not sure what the state's going to use that money exactly for. We have the budget and we're going to look at it. My guess is, knowing the state of Missouri, most of it's going to go towards medical protection equipment for guards or law enforcement, things of that nature, which is what also that grant can be cover. But we're hopeful that some of that funding can go to nonprofit organizations through a grant process to help with reentry.
Thank you. I think what's important to know is that it's been a long-standing strategy to try to get community-based organizations to organize around federal funding that typically goes to law enforcement. This money is made available through the CARE stimulus package, and as many of you may know, there's a fourth stimulus package that's just starting to get discussed in Congress. It includes some provisions around incentivizing states and localities to release people, given the COVID-19 pandemic, release people from correctional custody. We're also organizing and trying to mobilize support for additional funding that can be used in a range of ways, not just for law enforcement, but also for reentry services, including housing and healthcare. So folks can get in touch with me if they want more information around that, but Missouri and Empower Missouri's leadership in particular is one example of a state organization mobilizing collaborators to prioritize that federal money towards reentry services, particularly given the pandemic. So we have many more questions, and we'll try to get to as many as we can before we wrap up the call this afternoon. So here's one from Louise. Where is there room for collaboration with immigrant detention organizations, folks I know who are working to also look at decarceration from detention facilities around the country? Are any of you working in coalition with immigrants' rights advocates who are also looking at decarceration?
So our network includes immigration reform as one of the social justice issues that we work on. And we often in Expo will say, you know, immigration reform is just mass incarceration reform 2.0, right? It's the same exact system, just with a caveat of the whether or not a person has documentation to be here or not. So I don't have any specific advice, but I would say that it's a very similar fight And anytime we can bind together, you know, we become stronger. So.
Great, thank you. Anyone else working with immigration advocates in their coalitions or in their states and intersecting that with other calls for decarceration? Well, I know that there is ongoing efforts in many state coalitions, a lot of leadership out of California and Georgia and other states around the country who may not be represented amongst the panelists today. But anyone who wants specifics, feel free to connect and we can provide you with some specific details around that advocacy. So there's a lot of questions for David in Ohio, a lot of advocates on the webinar today from Ohio. One question in particular, David, is what successes have there been around pushes for clemency for people with long-term sentences? And I'd like to see or learn specifically about any successes during the pandemic, if there have been any.
Thanks for that question, and hello to my fellow Ohioans. The governor has communicated, I clearly, to anyone who's been convicted of a crime of violence. And you know, the thing that's so frustrating about that, I mean, I'm so tired of this nonviolent, violent, false dichotomy, because the truth of the matter is that while somebody may have committed a violent crime decades ago, that doesn't mean that they're a violent person today. So the governor has basically drawn on a red line. He did grant a commutation to a client of ours recently, but it was a situation where she had was the victim of human trafficking and killed her trafficker. And so that's an unusual, exceptional case for him. So the clemency route is mostly not going to be successful in Ohio right now. And one of the things that we're hoping to do in a long-term way is change the conversation around clemency. So many governors are reluctant to use it, particularly in cases involving serious crimes. And they ought to use it. They certainly ought to use it. And one of the ways that we're going to start to change the narrative around it is by getting people out who've been in a long time through other mechanisms, and then showing their success stories. Because this is an opportunity for governors to do justice, because often the system is not just. And so, unfortunately, not a good route to go even with COVID, but in the long term, hopefully we'll change that. And we need your voice to help change that. So please join with us and join with others who are trying to open up some eyes on this issue and hearts and minds.
And that experience is probably true in other states where there's been active efforts around clemency and commutation as well. So I'll ask Aisa's question. I hope I'm saying your name correctly. And this also amplifies a question from Jane out in California. Aisa offers the question, how can prisons offer social distancing when many are overcrowded? And then I'll add Jane out of California's comment to this as well. Jane adds that, you know, California honestly isn't doing that well either, despite it often being mentioned among states that have done something. It's reduced its prison population modestly by 3,500 in response to some litigation. The state prison system is still chronically overcrowded. And so that modest decline isn't doing much in terms of meaningfully reducing the prison system so that social distancing can be implemented. So what say you all in reaction to Aisa and Jane's comments around how can social distancing happen inside of overcrowded prison facilities around the country?
I'll start with that. And with the prison system, how can you have social distance in between people when if you sleep in a bunk and in prison, you only have 32 inches between each other? And it's 83 people in a dorm, and there's 6 fans going round and around. There's no such thing as social distances. And we're just really upset with our governor here that, you know, we have not a young lady, we have a lady that was in prison over 40 years, got COVID. They took her to the hospital, and then when she got a little bit better, they brought her back to prison with oxygen. And you know, her papers are sitting on the governor's desk, so her sentence could be commuted. So we highlighted that. We actually went to the press, put it in there, and we got some coverage on it. But the governor is almost like he's afraid to sign because the lady's been vetted. There's close to 200 people in the state of Louisiana that has been before the pardon board, has been vetted and been granted, and is sitting on the governor's desk. And all the governor has to do is a stroke of a pen. Now he's let 2 or 3 out, but guess what? If we don't continue to put pressure on the governor, how can it change? And, you know, there's no such thing as social, you know, distancing in prison. There's no such thing. There's no kind of way to do it. You go to chow together. There's one little, I think they have, when I was in prison, there's 4 toilets, everybody shower. There's no way that you can social distance. So, you know, we have to stay on doing what we're doing, advocating and coming up with different strategies. You know, I've heard something today that I can take back to our people and from David. I heard something from Sarah. That's what we have to do. Nobody has the best mousetrap. We're building this mousetrap, and this mousetrap is to dismantle the mousetrap, if I can put it that way. You know, that we can find a way to let people out. Like David is saying, when you've been in prison 40 years, I was in prison for 20 years, never had a write-up, never had a rule infraction, graduated from college, all of that. And I've been out now 17 years and have no problem. We need to highlight those people that's coming out across the country. Yeah, somebody is always gonna mess up. I saw a legislator mess up. You know, I've seen policemen mess up. They didn't close the police down. I've seen state troopers mess up. So we have to highlight, and we have to, if we don't be the voice, who's gonna be the voice?
Anyone else want to add anything? I'll offer in response that clearly there's a lot of dedicated activism and advocacy that's happening. You've heard many strategies this afternoon, from litigation to organizing to collaborating amongst seasoned advocates who were doing work even before the pandemic started. In response to many of these calls to action, the releases have been modest. One example, one cautionary tale, is out of Oregon, where in trying to respond to reducing the number of people incarcerated to prevent spread of COVID-19, the governor directed the State Department of Corrections to estimate how many people needed to be released in order to implement social distancing. In that correctional facility, the Department of Corrections estimated that close to 6,000 incarcerated residents needed to be released in order to implement social distancing. The governor rejected that recommendation for large-scale releases to implement social distancing, and said that releases would happen on a case-by-case basis, not meeting the spirit of urgency that this pandemic demands. And it's unfortunate because that's a progressive governor in a supposedly politically progressive state, and yet substantial resistance, given the evidence-based analysis offered by the State Department of Corrections around what needed to happen in order to adopt social distancing. So I'll say again what I said earlier, and that is that while some states are doing more than other states are, no state is doing what they need to be doing. So I'll just try to go to some of the other questions that are offered today. Does anyone, Sarah, David, Christine, have any comments to offer in reaction to any of these questions or comments as I try to find another question to offer this afternoon?
I just want to comment on, I think it was Checo that said earlier, you know, if we don't advocate, who will? That was something that during my last sentence, or the last time I was incarcerated, we would oftentimes talk about the stuff that was going on in there. And I would always think about, nobody's going to know this unless we talk about it. Nobody, you know, because people aren't just going out and seeking, oh, I wonder what's happening to people in our local jail or what's happening to people in prison. And so that's why for me, it was so important to take every opportunity available to me to do just that. And it's just, I get really excited to see others doing the same. And so we have a movement building in America, in the United States. It needs to get bigger though, because we also have the biggest incarcerated population than any other country. So, but there's a lot of people like me that aren't gonna let the stuff going on back there be forgotten.
Great. Anyone else want to offer comments, feedback? Well, so there's so many other questions. Go ahead.
Well, you know, it is just so good to see people from across the country that's doing this. And if we don't tell the story, who's going to tell the story? I mean, you know, we're the examples that something good, that was a phrase coined in Angola, can anything good come out of Angola? Well, certainly there's more people that have gotten out of prison that are doing well. I know people that's got their own business and working every day, paying taxes and everything. But people don't know that until you actually do it. You know, I go to church, I teach Sunday school, I do all that. I made a mistake years ago. I take responsibility for that. But, you know, I'm not the same person I was 1983. That's 30-some years ago, 37 years ago, you know. So people in prison has been in there. I know people that was in prison there before when I got there, and they're still there. And I'm like David, those people deserve an opportunity to be free. And if we work there, we're actually working with a group called the Parole Project. We have a house, Boat has reentry 72 plus, that we house people when they come out, and we don't charge them anything. You know, the Parole Project, they don't charge them anything, because when the Graham and the Miller cases came down for juveniles, they had to have a place to go. So we as advocates and former incarcerated people, we took the initiative to do that, because who knows it better than us? We know what it is that feel like coming out and nobody let you give you a job, nobody give you a house because of your background. So we created that for our own self so we could help our own people. And sometimes the media pick it up, sometimes they're not interested, but we keep banging at the door. We're gonna keep banging at the door until we knock the door down.
Yeah, thank you for that. So we're coming up on the top of the hour. I want to offer an opportunity for each of our panelists to offer any last comments, including ways for folks on the webinar to participate in any activism or advocacy actions that you all are organizing around. So we'll start with how we started. Checo, do you want to offer any last comments?
Well, my last comments would be, we heard in the parish prison here in Baton Rouge, Louisiana, they were going to take the prisoners from the parish prison and then take them to Angola, put them in a place that had been condemned. And that's what they were going to do. The COVID, people that had COVID, that was pretrial detainees and everything else. And we just screamed loud, put it in the press, and had nobody said anything, they wouldn't even know where their loved one was. So we have to continue to be connected. We have to continue to have strategy, and we have to be continued that, you know, there's no big I and no little you. We have to work together. And I'm finding out that, you know, when we suppress ourselves and just say we're working for people, God will provide.
Thank you. Christine, did you have any last comments you wanted to offer?
Sure, that I would just say that, you know, our work isn't going to end with the pandemic. This is the last week of the Missouri legislative session. So the Missouri legislators took some time off, but they came back right here in the midst of all of this pandemic and have been passing and trying to pass large pieces of legislation with some more horrible criminal justice flaws in it. So pandemic or no pandemic, our fight isn't going to end. And we're continuing to fight on our state level on lots of fronts. So anybody in Missouri, we'd love for you to join us and continue to work on our state legislature. You can visit our website, it's empowermissouri.org. Our call's Friday at 11 is the next one, so tomorrow. So please join us if you can.
Great. David?
So Martin Luther King Jr. is famous for saying that the arc of the moral universe is long, but it bends towards justice. I think that when we think about decarceration, those words have special meaning. And the one thing I would add to that is the arc of the moral universe doesn't just bend on its own. We bend it. We bend it through our work each and every day to grind it out and push and never give up. So my last words are, I hope that everybody who is listening, everybody who is a co-panelist, that we won't give up hope, that we'll take advantage of this opportunity to really focus in hard on getting decarceration to happen in a substantial and meaningful way, even beyond COVID. And I just want to say, I am so grateful to have been on this panel today, because my brothers and sisters in Wisconsin, Louisiana, in Missouri, and those of you who are writing in from all over the country, I feel more hopeful just based on your energy and your commitment to this issue. So thank you.
Great thing. And Sarah?
I'll keep it short but sweet. We all have power, but we have more power together. So let's come together.
Great. Thank you all. Thank you for your time today to the panelists, and thank you to all of the audience attendees. We had close to 300 people join us this afternoon, which just demonstrates how powerful this conversation is and how much energy and need there is to continue this dialogue and work to help people who are incarcerated right now. I want to wrap up by inviting you all to get in touch with the Sentencing Project. You can see our advocacy at sentencingproject.org email address here. We participate in organized strategy calls. We can help make connections to state coalitions if you aren't already plugged in, similar to the next step that Christine offered in Missouri. And, as someone who works at the Sentencing Project, I try to keep track of decarceration strategies that are happening right now in the pandemic and even before this public health crisis started. So reach out and we can help to connect. And with all of that, we wish all of you continued health and continued resilience as we work to support people who are inside. Thank you all.
One last word. We have a word that we say we're ready to fight one day longer than they are. And we have this, I'd like everybody to understand: no surrender, no retreat. No surrender, no retreat.
I'm with you, brother. All right. Thank you. Thank you to everybody. Bye.